Good afternoon once again, and thank you for being here. I look forward to taking you through today's session. My name is Stephanie, and I'm one of the anatomists, a part of Learning Curve's team, and I help support the use of Primal Pictures in the educational setting. It's really great to have you here today, and I'd love to hear a little bit from you in the chat box if possible. If you can let me know if you've used Primal Pictures before, that would be great to hear because that will help me know what sort of level of detail I should go into today. But we're going to explore some really great teaching strategies while using the cardiovascular and respiratory systems as our examples today because they are so heavily connected. If you have any questions as we go through the session, please pop them in the chat box and we will have some time at the end where we can address any comments or questions that you may have while we go through the session. But I hope you enjoy, and I hope today gets you excited about the power of Primal Pictures and implementing it further at your institution. So just a bit of an agenda of what we'll go through today. I'll make you aware of all of the support you have available to you as Primal Pictures clients through Learning Curve, and I implore you to make the most of the services that we offer because that's what's going to empower staff and students to use this great resource. I'll then take you through the access and navigation of this resource so that you know exactly how to access whether you're on campus or off campus. And then I hope to get your blood pumping by exploring the cardiovascular and respiratory systems with you. We'll go through teaching tips and tricks and some features that are really going to help the students. And we'll use 3 titles while we go through those tips and tricks. Please forgive me, there's a little bit of an error on this slide. It says the first title is Anatomy and Physiology. Our first title will be 3D Atlas. After that, we'll take a look at 3D Real-Time, followed by Diseases and Conditions. So what support do you have available to you? Learning Curve has a team of anatomists, and we are very passionate about making sure that our users are empowered. So all of our institutional clients are entitled to 6 free training sessions. These form part of your subscription costs, and these can be used at your own discretion for staff and students. You are welcome to reach out to us at any time with questions or queries, and our generic Primal Pictures email address is available at the bottom of the screen if you don't know how to contact us. But if you are ever experiencing concerns outside of the normal working hours or have any major technical issues, then Primal Pictures does have their own client services team, and you are welcome to reach out to them. Their email address is displayed in blue on the screen right now, and you can save that in case you need it in the future. Okay, then we have these free webinars that are run each month, and we also have a wealth of fun and educational content on our social media platforms. So we are on Instagram, YouTube, and TikTok. Our handle is anatomy_sucks. And here we're just having a bit of a joke and trying to relate to the students because it breaks our educators' hearts. But unfortunately, most students do think anatomy sucks. And that's because it's a large subject that can feel overwhelming. And we use these social channels to show them anatomy does not suck. So on our Instagram, that is where we post some educational content and very importantly, advertise our free monthly webinars. On YouTube, you will find a range of training videos, long form and short form. And these can be really helpful to embed in your learning management system so the students have the training videos readily available to them. And then lastly, we're on TikTok. And I'm going to be honest, that's mostly just to have some fun and really relate to the students and their experiences. We do have our student webinars being run next week, just like these staff webinars that we are running this week. And in that training webinar, we are going to focus on the biomechanics and the functional anatomy of the human body. If you received the invitation to this webinar, then you should have also received the registration links for the student webinars. So please do share those out to your student groups. And if you don't have access to those registration links, you can just pop in the chat box. Steph, please send them to me and we can email those through to you after the session. but those links can also be found on our Instagram page. Okay, now today I'm going to take you through some of Primal's educational experience relating to, as I mentioned, the cardiovascular and respiratory systems. But what I want to highlight here is that Primal Pictures, the full product set, offers a very comprehensive experience through the entire process of what a student needs to know when it comes to the anatomy and physiology of the human body. So we can go through the gross anatomy of the human body and relate that to the body donor or to the patient through authentic dissection images. Then you can dive deeper into function by taking a look at the physiology, at the microanatomy, and the function. Then we can start to put on more of a clinical or a cross-sectional lens by taking a look at the imaging content available on Primal. And then we can really go into the clinical application by taking a look at surgical procedures or diseases and conditions. And then lastly, we also have assessment modules, which can help the students figure out how much do they understand and are they ready to sit their exams, or do they need to revisit some of their learning. We're not going to go through this entire process today, but we will go through gross anatomy, we'll go through dissection. We're not going to take a look at function today, but we will go through some imaging as well as some clinical content, and assessment we won't touch on today. Okay, so how do you access this platform? If you are on campus and connected to the university Wi-Fi, you can go directly to the website, which is anatomy.tv. When you are connected to your university Wi-Fi, it should always log you straight in. When you are off campus or not connected to the university Wi-Fi, you will need to go through your library database, and I'll show you how to do this. If you ever experience any issues, you can chat to your librarian or reach out to us, and we'll always help as much as possible. Now, I don't want to confuse you, but a couple of our clients do access Primal Pictures through username and password. If this is your case, you should be aware of this, but most of our clients do go through IP authentication, which means you go directly to the website when you're on the campus Wi-Fi. If not, you will use your library database. Primal is predominantly an online platform. However, it's very important to have easy offline access. So most of the content is downloadable, and I'll show you those features today. The content can also be embedded in your learning management system. And if your LMS is rated 0 data for your students, which I know quite a few institutions do have, that means if the content is embedded in the LMS, again, the students can access it at a 0 data rate. And then, very importantly, there are apps available for download for 2 of the Primal Pictures titles, and that includes one of the titles we will take a look at today. There's some instructions on your screen on how to download those, but I have a really easy to follow PDF that gives you those instructions on how to download the applications. So if you would like us to email you that PDF, please in the chat box say, please email me PDF, and pop your email address there, and we'll send that to you after today's session. Okay, but what are we going to take a look at today? As I mentioned in the beginning, we're going to go through 3 titles, and we're going to use the cardiovascular and respiratory systems as our examples because they are very intricately interconnected due to their functions and their positions within the thorax. Understanding their relational anatomy and this interconnection is very important for a comprehensive understanding of the anatomy and physiology within the thorax and within these systems. And that's why we're going to use that example for today's training session on how to use the power of Primal. We will take a look at some of the normal anatomy through various 3D models, MRI images, and dissections that will predominantly happen in 3D Atlas and 3D real-time. Then we will explore the clinical application by taking a look at some cardiac and pulmonary diseases. And while we take a look at all of these examples, we will discuss helpful tips and tricks for teaching strategies using Primal Pictures. Okay, but let's not bore you with death by PowerPoint. Let's jump into the platform and get into the meat of today's session. So please bear with me while I just change which screen I am sharing with you. Okay, so I'm now going to jump into the platform, and let's pretend that I am from a university. I'm sitting on campus and I'm connected to my university Wi-Fi. If that is the case, in order for me to access the resource, I can go directly to the website, which is anatomy.tv, and I will be logged straight in. If you are off campus, as I mentioned, you need to go through your library database. And I'm going to use the University of Venda as the example today. So here I am on Venda's library website, and I am on their database page. Primal Pictures should be listed here for your university's library website, and it could be listed under two different names. It could be listed as Primal Pictures, or it could be listed as anatomy.tv. These two things mean the same thing. So here under A for Venda, it is listed as anatomy.tv. So if I'm off campus, I can simply click on this link and then it should log me in. Okay, but now back to the platform over here on anatomy.tv. Here I'm presented with the welcome page, which gives me some context of the sorts of content that I will find here on Primal Pictures. And the next icon in the menu is the titles page. This is where you will have all of the different titles available to you at your institution. My preferred way of using Primal Pictures is going directly to the title that I know is going to meet my current needs for what I'm wanting to teach or learn. But it's difficult to do that in the beginning when you're not so acquainted with Primal Pictures. So there are some other really helpful features to help you filter the content and find what you need. Underneath my titles page, I have recommended, favorited, and recently viewed tabs. These are here to help me customize my experience. And you'll see that it's asking me to either create or sign into my personal profile. This isn't something that you have to set up, but I do recommend it for seamless access to your customized experience. So I'm quickly going to sign into my profile over here so that I can take a look at my recommended content, my favorited, and my recently viewed content. As I mentioned, this isn't something that you have to do, but it is something that I do recommend doing. Now that it has signed me into my profile, I have myself listed as a radiology student. So here I have content recommended to me based on what discipline I have said I either teach or study. And then I can also favorite learning modules and see my recently viewed ones. I'm going to not discuss the Learn tab today for the sake of time, but if this is something you want to know more about, you can let us know and we can give you further information at a later time. But I'm going to move on to the other tabs, which are going to help you filter information. So we can browse through all of the Primal Pictures content, either by a regional approach, a systemic approach. We can also filter it by the different types of media on Primal Pictures. So we have movies or videos, we have 3D views or 3D models, we have slides, which are 2D images, and we also have animations, and these are mostly functional anatomy or biomechanic animations. Then we also have by title, but this is the same as the list of titles on the left-hand side of your all titles dashboard. Then there is also an alphabetical index, just like you would find in a traditional textbook. But one of my favorite sayings is, when in doubt, search it out. So we do have the search pane at the top of the screen, and you can search for anything like the heart. It's one of the structures that we will take a look at today. And here I will get all of the relevant information available to me relating to the structure that I have searched. and you can open up multiple search panes at the same time. So today I'm also interested in learning about the lungs. So I can search for the lungs, and here I have all of those results available to me. And I can toggle between the fields and click on the various types of media and work my way through my teaching or learning experience. Okay, and then if you have a personal profile and you wish to make changes at any time, you can do that with this icon at the top right-hand corner. What I could do is I could edit my profile, and now I can say that I am a faculty member and my specialization or my teaching field is dentistry, and I can submit that, and then my dashboard is going to change according to what I have said my specialization is. So now under my recommended title, I have recommendations for dentistry. Okay, so that is some navigation information to help you work your way through this homepage. But let's now dive deeper into the titles that we're going to discuss today. We'll start with 3D Atlas and take a look at some of the gross anatomy and some imaging content, as well as a little bit of clinical content. Then we're going to dive into 3D real-time, which is the very, very powerful 3D gross atlas of human anatomy. We're going to see some really great 3D models here, and I'm going to tell you how you can use the offline apps to use augmented reality, a really exciting feature that gets the students pumped about learning anatomy. And after that, we'll go into more clinical application, looking at diseases and conditions. But let's jump to 3D Atlas, where we're going to start. And you can see that the body is broken up into different regions. And because we're learning about the cardiovascular and respiratory systems today, we're going to choose the thorax and abdomen, because hopefully the thorax is where I'm going to find those systems. So that's now going to load in a separate pane. And what I will do is start with just orientating ourselves on the page here. So on the left-hand side, we have our menu bar. In the middle, we have our main viewing pane, where we're going to take a look at our learning content that we select. And on the right-hand side, we have our information pane. And here, it starts off with giving us some helpful information on how to use this title. But you'll see that that information pane will change as I start interacting with the learning content. So the first icon in our menu gives us the different 3D views or 3D models available, and they are broken down into regions. And as you maximize these lists by clicking on them, you will see that the key organs and organ systems have been modeled. So today I'm interested in the cardiovascular and respiratory systems. So these models over here are what are going to be relevant to me. So I'm going to select the 3D model of the heart and lungs because I want to take a look at these two systems together and how they relate to each other. So here my 3D model has opened up. The first thing we need to know is how to interact with this 3D model. So you will notice that as I hover my mouse over any visible structure, I will get the name of that structure. And if you select it, that structure will be highlighted. And now in our information pane, we will get detailed explanatory information about that structure. If I change what structure I have selected, then my information is going to change accordingly. Before I start rotating or changing the 3D model, I want you to be aware that by the time I share my screen over the internet, sometimes these models move a little bit jittery, depending on yours and my internet connection. But when you use this yourself, you will see that it's nice and smooth and seamless for the end user, and that's what I will be experiencing. So I can rotate my model by clicking the left and right arrow keys, or I can simply click down and swipe along my screen. And now I can take a look at the posterior view of this 3D model. Let's go back to the anterior view, and then at the bottom here, we also have some up and down arrows. So if I click down, I'm going to start removing some of the anatomy. So now we're just focusing on the heart and some of the major vessels over there. But if I click up, we're slowly going to learn about the relational anatomy. So here more structures are being added. I can now view some of the anterior aspects of the thoracic cage, and I could explore how the heart and diaphragm and some of these vessels sit in relation to our sternum and our costal cartilages. If I continue to click up, we're going to add in even more anatomy, and now I can explore how everything relates to our lungs. And if I continue to work my way up, then we will add in more structures. Here we're now seeing the pleura and some of the important intercostal vessels before we then add in our entire thoracic cage and see how the whole picture comes together. Okay, so that's how you can interact with these 3D models. Now, before I go through the rest of the menu, I want you to bear in mind 3 things. Number 1, I can use this as a live lecture tool. I can project this screen to my students and I can teach them about the important structures, and I can use the information pane to guide me in the information I deliver to my students. Later on, when we get to the icons at the bottom of the menu, I'm going to show you how to share a link to content. So it's really helpful to find content that relates to your teaching and put those links in your teaching content or in your LMS for the students to go and further explore the anatomy or whatever content you are teaching them. I'm also going to show you how to download this content and incorporate it into your PowerPoints, your Word documents, your tests, anything like that. And then, perhaps most importantly, there's the embed function where you can embed this content directly into the LMS and curate what your students are seeing. And the full interactivity, like being able to rotate the models and change the layers, all of that interactivity will be retained when we embed the content into the LMS. Okay, so bear those aspects in mind while I take you through some of the other content, and then I'll teach you how to do those when we get to the bottom of the menu. So after our 3D models, we have imaging. This is where we can take a cross-sectional approach to the anatomy and take a look at a cross-section 3D model at the same time as a cross-sectional MRI. Here I've chosen an axial section, but we also have sagittal and coronal models. So here I can take a look at the lungs as well as the heart at this cross-sectional level, and you'll see that when I highlight structures either on my MRI or on my 3D model, it highlights it on both, and it's helping me interpret this MRI image and starting to think about how am I going to be seeing this anatomy in the clinical setting. You'll see my information pane has now moved to the top of the screen, and I can scroll through this information and still learn about it while I explore it in this cross-sectional manner. Okay, and then after that, we have some slides or 2-dimensional images. Under the anatomy section, they're organized by system, and here you'll find some really great labeled images. These can be fantastic to download and incorporate into your lecture PowerPoints or into your LMS, for example. After the anatomy slides, we have clinical and dissection slides. And I do want to warn you now that I'm going to open up some photos of some real patient anatomy and real body donor anatomy. So if you are sensitive towards this, I'd like to warn you in advance, and you can take your eyes away from your screen, and I'll tell you once we're finished looking at the sensitive information. Okay, but I'm going to open up the clinical slides now. And once we maximize these, we have some images of pathological manifestations, either in body donors or in patients. So here I have an image showing me the effect of acute myocardial infarct, and we can see tissue necrosis over here due to the heart attack. Here I have another example, which is an image of an aortic aneurysm, and this has been dissected out, and we can see what that would look like. I'm still going to be looking at some sensitive information while I move down to the dissection slides. So here we have body donors and we have images of some dissections. Let's take a look at this example, which is helping us see the fibrous framework of the heart and the muscles that make up the chambers of the heart. You'll see that these dissection images are still fully interactive. So I have rollover labels for all of my visible structures, and I can still select structures to get important information about them. Okay, I'm now changing what is on my screen. And for those who did look away, there's no longer sensitive content on the screen, and you're welcome to look back if you feel comfortable. But the last section in my slides are MRI still images. So these again are still interactive, and these are simply still MRI slices that have been taken from the interactive ones that we looked at earlier. Okay, the next icon in our menu are movies or videos, and here we have some videos that are going to help us understand the surface anatomy of the thorax and the trunk. Then after that, we yet again have 3D models, but this time they are organized by system. At the top, we had 3D models, more so organized by region, and it was taking more of a broad brush approach to the 3D models. This folder icon takes a very detailed approach to the 3D models in terms of the systems. So let's now look at a different aspect of the cardiovascular system. Let's take a look at the arteries, and let's look at the arteries of the pelvis. And you'll see that it lists individual important arteries that are going to be highlighted in these 3D models. There are certainly other structures in the 3D models over here, but very importantly, we can take a look at the large femoral artery and again get the information about it. Okay. Now the next icon in our menu is yet again an alphabetical index to help you with your navigation, but at the top of your information pane, you still have a search bar. So when in doubt, search it out. After that, we have a favorite icon, and this is going to allow us to add favorites to our profile. Let's say I want to use this 3D view in a lecture tomorrow. I could come and save my 3D views to my favorites so I can easily reopen them in the lecture hall. But there's one important thing I want to highlight here. You will see that it says my favorites are stored to the cloud, and that is because I'm logged into my personal profile. So that means no matter what device I'm accessing Primal Pictures on, whether it's my personal phone, my work computer, my personal computer, if I'm logged into my personal profile, I can see my favorites on any device. If you don't create a personal profile and you favorite content, then it's going to be stored to this device that you are currently using when you click Add to Favorites. So instead of saying stored in your cloud, it's going to say stored in your browser, and that means it's stored to this device. So be cautious of that if you're favoriting content to open up in a lecture. If you're going to be doing that, I do recommend using the personal profile feature so that all favorites are stored to the cloud and you can log into your personal profile on any device and access your favorites. After that, we have the share link icon. So each individual piece of learning resources that you can find within Primal Pictures has its own unique link or HTML5 code. So you can copy the link to absolutely anything you view and you can paste it in your teaching resources or in your LMS or send it over to a student if they've come to you with a problem and you know of a specific piece of learning content on Primal that's going to solve their issue. The next thing that I strongly recommend is embedding the content in your learning management system. The research has shown that students love studying from Primal Pictures. However, sometimes they don't love taking the time to find the content that's relevant to them. And that's where embedding is very important, because we've seen that when the content is embedded for the students, it makes their learning experience much, much quicker using the power of Primal, but at home in their LMS where they are used to finding their learning resources. So at the moment, I am embedding this 3D model that I am looking at. But if I wish to also include the information pane, I must select Embed Text. I can also include the link to where this came from on Primal Pictures if I want to. And then I can play around with window size and see what works best on my module layout page. Lastly, you can select your LMS style. We have all of the major LMSs that are used in education, but if your LMS isn't listed here, which is quite unlikely, you can use the generic iframe tag, which should work on any website. Here, I now have my embeddable code, and I can copy that code and go and paste it into my embed function on my LMS. After that, we have the download function. Again, very important. So if you're wanting to incorporate content into your PowerPoints or your tests, you can download anything and pop it into your material. Okay, and an institutional license to Primal comes with all of the necessary copyright for you to do whatever you want with Primal Pictures within your institution. You can use it for any research or teaching purposes. Okay, and lastly, you have some settings that you can change according to your personal preferences. But that brings us to the end of 3D Atlas. If you have any questions, please pop them in the chat box and I will address them at the end. After that, we are now going to jump into 3D real time. And this is where we have the really powerful 3D models. We can perform a virtual dissection. We can create custom study diagrams, teaching diagrams, or test questions. And very importantly, if you use the app version, you can use augmented reality, and I'll show you what that looks like. So again, we have different regions of the body, and I'm going to choose my thorax because that's where the anatomy is that we are concerned with today. And now this is going to load my powerful virtual dissection table. Okay, starting with orientating ourselves once again. On the left-hand side, we have the menu. In the middle, we have our main viewing pane or our virtual dissection table. And on the right-hand side, we have a list of structures. And this is where we can create our own 3D model. So let's briefly start with that. On my dissection table, I can clean this to a blank slate by clicking clear at the bottom of the screen. And I could use this list of structures to create a custom 3D model. So if I click on heart, it will add all of the structures in that group of structures. But if I click the arrow next to the heart, you can see that I can maximize these lists and add in individual pieces of anatomy one at a time, or I can add them all in. I could also add in some major arteries relating to the heart, but I'm not going to spend too much time here. I just want to show you a bit of an example of how we can create our own 3D model, but I'm going to rely on the pre-made models for today's session. And in our menu on the left-hand side, the second icon is where we will find the pre-made models. I'm going to scroll past the dissection images. We will touch on those later, and I will give you a warning when we do. But here again, we have the key organs and organ systems already modeled for us. So I'm going to select the 3D model of the heart and lungs, and I can choose 5 different tissue depth options, depending on what I want to learn about today. But I'm going to choose this third option over here, and I'm going to work with this one. And now I'm going to show you how to interact with these models and do a virtual dissection and learn more about the anatomy. I want you to consider 2 things while I do this in terms of teaching strategies. Once again, I could use this as a live lecture tool to explore the anatomy with my students, And I can also use this to create custom labeled anatomy diagrams or test questions. A third thing, actually, that I would like you to consider is that you can share a link to anything you create here for your students to use. So once again, I have rollover labels for all of the visible structures. And if I select them, I will get the name at the top of the screen. And if I click the speaker icon, it will give me the pronunciation of this structure. Now we have a range of ways in which we can engage with these models. You can you can rotate them, excuse me, by clicking down with the left icon, the left cursor on your mouse and swipe along your screen, and that is going to rotate this model. You can zoom in and out of your model by using the scroll function on your mouse. And you'll see that when I scroll in really, really close here, our nerves, which are very small structures around the arteries over here, are in very high detail. If you know the ligamentum arteriosum, you know it's a very tricky structure to visualize, even when doing a dissection. And here we have it clearly visible between the arch of our aorta and our pulmonary trunk. Now you can also learn about the structures as you interact with them using the text box. And again, if I'm using this as a live lecture tool, I can use this text box to help guide me in what information I'm telling my students while I explore the anatomy with them. Now let's go through our dissection tools at the bottom here. Number one, I've selected the superior lobe of the right lung. And if I click context, I'll get that structure with its relevant anatomical context. So what's relevant for us here is seeing how the trachea branches into the main bronchus and then the secondary, tertiary, and terminal branches. If I deselect context, we'll go back to where we were. If I click inspect, it's going to isolate just that structure. And now I can appreciate the shape and form of just the superior lobe of the right lung. And if I deselect that, we'll go back to where we were. If I click examine, everything else is going to be turned into X-ray mode except my selected structure. And here I can explore the relational anatomy in more detail. Next is one of my favorite features, which is the ghost icon. What's happened now is that structure has turned into X-ray mode, and now I can see how the bronchi are branching within the superior lobe of the right lung, as well as some of the major vessels. And if I want to take this one step further, I can select any structure and click hide, or in other words, dissect the structure away. And here I can simulate that lab experience, and this is really, really helpful for preparing for a dissection. If your students don't have access to body donors and dissection or prosection, this is going to be a really important tool for you and your students so that they can learn accurate anatomy in a 3D way. If you don't know already, all of Primal Pictures 3D models have been built from real scan data. So this means this is a real body donor and real anatomy that we are looking at, which is really important for meaningful learning. Okay, I'm going to warn you now that once again, we're going to take a look at dissection images. So if you don't wish to see this content, please look away and I will tell you once we're finished looking at it. At the second icon of our menu where we found the 3D models, we also have dissection images. These are the same dissection images that we saw in 3D Atlas, but now we can see the dissection images next to your 3D model that is mirroring the dissection image. So firstly, what I want to show you is we have 4 3D model options next to our dissection image. So from the far left, we can take a look at superficial anatomy that is then dissected away before we get to our dissection. And now I'm going to make my dissection half the screen so that my digital twin and my dissection image are on a very similar scale. So when I highlight anything on the dissection image, it will be highlighted on the 3D model. And I think a good example over here is our great cardiac vein. So let me deselect it quickly. Do you see it's incredibly difficult to see how that tortuous vein is moving across the surface of the heart because it's still covered by connective tissue. And when it comes to the body donors or the patients, I think that students often forget how difficult it is to actually identify a vessel. So I can select that vessel here on my 3D model where it's easy to see, and now it helps me visualize it there on the dissection image. Okay, there's no longer dissection content on my screen, so if you didn't want to look at that, you're now welcome to look back at the screen and we won't look at any further sensitive images right now. I'm going to change the 3D model on my screen back to, let's take this 3D model while we go through the rest of the menu. So I'm going to zoom in a bit and let's work our way through. So we still have the favorite icon. Let's say I want to use this 3D model in an upcoming lecture. I can save it here and easily open it up in the lecture hall. The next icon has some settings available to us. I'm not going to go through all of them now, but an important setting is the body donor color setting. If I switch this on, this is going to get rid of that color coding and force my students to think really critically about the difference between an artery, vein, and nerve based on their anatomy and not based on their color. Another important setting, which we don't see right now, is the augmented reality mode. So I'm very quickly going to open up a video which shows me using 3D real time on my phone. In this video, I'm going to show you what the augmented reality function looks like. So if you download the 3D real-time app and you go down to the settings on the left-hand side, you will see there is augmented reality mode. I can select whether my model is on a surface or mid-air. I can also select its orientation, whether it's erect in anatomical position or laying down, supine or prone. And once I'm happy with my settings, I will toggle on AR mode. So let's just wait for a moment for that mode to be toggled on. And then the camera on my phone will switch on and you can see an orange dotted grid where it was tracking my surface. Now I have my selected 3D model available in my reality. It's sitting on my desk and I can move around this 3D model. And all of my dissection and interaction tools are still available. So using AR, I can still dissect structures away. I can click on the text box to still learn about these structures. And if we think in quite an exciting way to apply this into teaching, you can use AR to superimpose these 3D models on a body donor before a dissection, or on a colleague or a student. If I'm a student, I can superimpose it on my friend and understand how the surface anatomy relates to the underlying anatomy. Okay, so I'm going to pause this and close that up now. Again, if you want the PDF on how to download the apps and use VR, let me know in the chat box and I'll email that through to you. Okay, then the next setting is where we have labeling and pinning tools. So there I've added a label into the subclavian vein. Now I'm going to add a pin into the ascending aorta. So here I can create a customized label diagram, or I can choose to alter the text of my label. And I could create a test question. I could say name the structure. You can also move these labels around using the move label icon. You can add in a freestanding text box, and I could call this question 1 if I'm putting this into my test. And you can also use the various drawing tools to highlight any specific structure or point. And then I can save an image of this to incorporate it into my test or into my PowerPoint or wherever I'm wanting to use this. So I'm going to click confirm download, and now it's going to download that image on a transparent background. So here's my image. I have my computer on dark mode, which is why the background is black. But if I pasted this image onto an orange background or a white background, then the background of the image will be the color of what you pasted onto. Okay, then once again, you can share a link to anything you have created or anything you are viewing. Really helpful to share with the students. And lastly, these arrows at the bottom of your screen are another way in which you can manipulate and rotate your model, but I rather recommend using your mouse. But if you get confused with how to manipulate the model using your mouse, then you can come down to these tools at the bottom. Okay, that's how to use 3D real time. Now we're going to spend a brief moment going through diseases and conditions to really start applying this anatomical knowledge into the clinical setting. So the diseases and conditions title has just under 100 common diseases and conditions that are organized into 16 different clinical specialties. And here we are going to learn about these different diseases. And while we learn about them, we will recap the normal anatomy. We will then learn about how that anatomy is affected when the disease manifests. It will take us through the disease progression and give us the causes, symptoms, and treatment of that disease. So let's scroll down our specialties and you'll see that pulmonology is here at the bottom, and at the top, I have cardiology. Let's use cardiology as our example today. And now, at the top of my information pane, I have the various diseases available to me within this specialty. So I'm going to choose a myocardial infarction, seeing as we saw an image of that earlier. And I'm now going to minimize this list of specialties by clicking on the book icon. I'm going to minimize my list of diseases by clicking the up arrow. And now I can focus on my main viewing pane and my information pane to learn about a myocardial infarction. Primal always tries to cater to different learning styles. So we have a video which is going to take us through all of the information that is in the information pane. I've got this video on mute and I'm going to let it play for a few moments. But here we have a narration of all of the information that's going to be shown, and we're going to have Primal's really great imagery to help us understand everything it's telling us about a myocardial infarction. I'm now going to pause this video. I'm going to scroll forward just so that you can see the important anatomy imagery is included in this video. But now all of this information is also conveyed in our information pane. So firstly, it gives us an overview of a myocardial infarction, its prevalence or its epidemiology around the world, and what it is. It tells us that this condition occurs when blood flow to the heart is restricted or completely blocked, and it causes irreversible damage to the cardiac muscle. Now it's going to recap the normal anatomy. And if I click on that image, it's going to come up in my main viewing pane. So it tells us the role of the heart, and it recaps some of the important microanatomy of the coronary arteries of the heart, because those are the structures that get blocked and cause this disease or the heart attack. It then tells us what a myocardial infarction is. It explains that it occurs due to atherosclerosis or the buildup of an atherosclerotic plaque within the coronary arteries, and explains how this fatty deposit buildup happens and what will occur over time as it accumulates. And then it is going to summarize the anatomical consequences of a myocardial infarction, including nerve stimulation, tissue necrosis, adrenaline release, and hypoxia of the brain. Lastly, we finish off with the causes, symptoms, and treatments. And these are packaged in PDF documents. And these have actually been created with patient education in mind. So if your institution is affiliated with a teaching hospital and your students or educators are working in the clinical environment, they can use these PDFs to educate their patients. So this one is going over the causes of a myocardial infarction. So it explains what this disease is and gives us the common causes and risk factors in a very easy to understand way so that the patients can be educated on what is happening inside their bodies. Okay, and then the rest of the icons in the menu should look familiar to you, so I'm going to whiz through them. Before I do that, I just want to remind you that you can come to your specialties and you can change what disease you're looking at any time. I could go to pulmonology and take a look at tuberculosis if I wanted to. But the next icon in the menu is where we have our alphabetical index. You still have your search bar at the top of the screen. You can still favorite content. Okay, it's just wanting me to re-verify my personal profile. I'm not going to do that right now. And you can see now that I'm not logged into my personal profile, my favorites are stored to my browser with this device. So I must quickly go re-authenticate my email address so that all of my favorites are stored to the cloud. Okay, and you can share a link to anything, you can embed anything, and you can download and save anything. But that brings us to the end of diseases and conditions. So very quickly, just to recap, when it comes to Primal Pictures, it offers a very comprehensive way for students to learn about the gross anatomy of the human body. They can go through dissection, they can go through function and microanatomy, they can take a look at imaging, they can take a look at clinical application, and they can assess their understanding. Today, we focused on gross anatomy by taking a look at 3D Atlas, and we took a look at some of the imaging and cross-sectional anatomy. We then could learn about anatomy in even more detail and use augmented reality here in 3D real time, where we could do a virtual dissection. And then we started applying our knowledge into the clinical setting by using the diseases and conditions title.